Okay, so this is the first time I go live. As you can see, I don't have anything on the background, and you can tell that I probably am not looking at the camera properly. However, as everyone know, just like the rest of the world, Australia is also affected by this, recent health event which is causing quite a toll everywhere else as well as here. Although in Melbourne, it's said that we are flattening the curve. So, yeah, now I'm at home by myself. So, instead of just sitting around doing nothing, I think it is a good time for me as a NATI certified interpreter and translator to go on YouTube, go online, and do something productive that may be useful for some people. I don't know who, but it may be. Okay, and as you might able to tell that I am my background is Chinese, so sometime when you hear me doing live or uploading video, you might see me speaking Chinese. Could be Mandarin, could be Cantonese. So today, having said that, here's what I'm going to talk about today. Today, I'm going to talk about what is an interpreter and what is a translator, especially in Australia perspective. And also, I will briefly talk about my own career backgrounds, aka, well, i.e., interpreters and translator. So I would like to talk about this, and hopefully, this might be useful for some people who, according to what I heard, who may be having a bit of confusion. And also, while we are going live, you might see me going mute because, as you can see, I have my cell phone next to me. And this means that there is someone calling in who requests my service over the phone, also known as telephone interpreting. Okay, so first of all, what is interpreter? Okay, an interpreter, by its definition, is someone who has possessed two language skills, i.e., English, or in my case, Mandarin Chinese and Cantonese Chinese, 国语, 广东话. So this kind of person, what they do is they try to understand the meanings of one language spoken or written by one party who is native of that language A, such as English. And once they understood it, they will just try to transfer the meaning of the source language to a target language, such as Chinese, or aka Mandarin, and Cantonese, Vietnamese, Arabic. Those are a few common ones here in Melbourne. So what they do is usually they have the interpreter, myself, and two or multiple parties who speaks different languages. One of them or both of them who has to speak the language that this interpreter understands. In my case, Mandarin, Cantonese, or English. So a scenario could be I'm going to a hospital, such as someone who got coronavirus, or he or she is suspected to have contracted coronavirus, and I will have to go in as an interpreter who get there and speak to some of them to find out whether this person, this patient who speaks the same language, usually an agency, the agency such as hospital or the interpreter's agent maybe already know that what language this patient speaks. But don't be surprised. There are cases where I went to the job and I couldn't understand a word that the patient or client speaks. So usually as a Mandarin interpreter, I'll get a phone call from my client or the agent. They'll ask me to go to a place, such as a hospital, to interpret. So if I go into the coronavirus clinic, I have to present myself to the front desk Or sometimes a hospital, they might have an interpreter's office where we have to go there and sign in and report ourselves. And then the interpreter's office or the receptionist, they will actually tell us who are we going to interpret for how, and then they will sort of, double check with us our names, our agencies, the time we booked for, and maybe sometimes the names written on our bookings. Who am I interpreting for? Once these are confirmed, the front desk or the interpreter's office will actually direct us and tell us where to go. So, such as like the last time when I went to the INU hospital, I was sent to the cochlear clinic, and then I went to the hospital, and then the front desk in fifth floor, they will say that, okay, sir, is this your name? And then once they confirm that, they'll tell me who the patient is. They'll confirm that with me again. Sometimes the patient's name are written on my bookings, which came in a form as an email. Right? This email is usually sent by the agency. So I'll look at the names. Once this name matched, the front desk person, usually a lady, they will say that your client's here or not here. And sometimes if they're here, they'll even point at the person who's waiting for me at the couch in the waiting area. And they will say that this is your client, and I will know who that is. And then usually I will sit down, wait for the doctor to get ready, and then the doctor will come out and say, Mr. or Mrs. Chan or Wang, and then they'll say the full name, and then this person will come out. You supposedly, the ideal case is before the doctor calls you, supposedly you should be sitting not too far away from your client, i.e. the patient, but not too close, where they might start chit-chatting with you and start talking to you, because sometimes they might want to, for the sake of giving you a background information, they might just go on and on and on, asking you about private issues, asking where you're from, asking, how long have you been working here? And as a professional interpreter, you don't have to answer that if you don't want to. This is not our job. In fact, this is contravened with our professional conduct, which I will mention in the future live stream. That we're supposed to be very neutral, right? And then we shouldn't take side. So supposedly we should have the two parties, no matter it speaks the non-English speakers or the English speaker, they should have the equal amount of influence or equal closeness, I would say, towards the interpreter. So you should be basically know who are you helping, who are you working for, but don't get too close at all times. So now, once you sit there, sit near the patient, wait for the doctor to call you in the INU hospital, what you will do is you'll get up with them, follow the patients by the guidance of the nurse or the doctor, go into the clinic room. So here's what you need to do. First of all, once you get into the room or even on the way walking to the room, you should say, hi, my name is XYZ, and then say that I am the whatever language interpreter. For me, I would say my name is Hong Yao Wu or Isaac Wu. I am the Mandarin interpreter, and this is my patient, Mrs. Wang. And then the doctor usually will do a bit of introduction of himself and tell you that, okay, my name is Dr. Smith, and I'm your physician today, or your senior consultant today. Welcome. And then they will go into the room. So what they do is usually, okay, now we talk about very important thing, sitting plan. So usually you can see three parties. There's the professional. Sometimes could be just one doctor. Sometimes could be a medical panel out of usually three maximum. Yeah, 3 to 4 maximum people sitting in one corner or one side. And then you have the patients and the patient's family sometimes, where they were sitting on another side. And there's you, right? You are the interpreter. So the sitting plan, the ideal sitting plan is always a triangle. Yeah, that's how a triangle looks. Yeah. So the doctor sits on one side, the patients and the family sits on the other side, and you sit in the middle where you can see them both at the same time, preferably in a sort of equal distance between them. You try not to sit too close to one or the other, because you don't want anyone to think that you represent them. This is particularly important when it comes to dispute resolutions or legal cases. So you try to sit in the middle. So you're neutral. And then they will sit down, introduce themselves, and then they will start talking. And the doctor will start talking about, hey, Mrs. Wang, this is the information. This is your condition now. Here's what we're going to do. And what you need to do is try to listen. You can take notes in your little notepad. In fact, I don't have my notepad here. Yeah, sometimes I use a much smaller notepad, not something like this. Like this size, for example. Yeah, this is my diary, but a notepad. As you can see at the end of the diary, there's some notepad place here, and I will take notes. Okay, Mrs. Wang. Okay, they will first confirm a couple of things. Okay, Mrs. Wang, can you confirm your name? Can you confirm your date of birth? Can you confirm your address? No matter where you are, as long as this is a medical appointment, by their code of conduct or by law, they will have to do that. So as an interpreter, you will always be aware that you will have to interpret names, date of birth, address of the client to the English-speaking professional. So sometimes this could be difficult because some of the client, they may be in their 80s and they just came to Australia in the past couple of years and they don't speak much English and they have trouble pronouncing all the address. So you have to be aware of that. Sometimes they had it written down somewhere. Sometimes they haven't written down anywhere. So they have to try the best to tell you, and you can at least get the numbers right. Okay, for example, I live in number 25 Smith Street. So they might not be able to pronounce Smith properly, but at least you get the number right. And then for the street names, sometimes the doctor will sort of help you and pronounce the words for you on your behalf. Sometimes you just have to figure it out. Sometimes the elderly person, the gentleman, will write down the street name, so you have to confirm the address. This is the hard part. You will much prefer the government one day to sort of, giving a mandatory requirement for all the migrants to able to pronounce all the English letters. That would be great from A to Z. So they can at least spell out each of these words, each of these letters, so everyone could understand. But unfortunately, this is not the way. So sometimes it could be a little bit of a hiccup. Okay. Then once that's done, they'll start talking about, okay, what's your condition? Usually the doctor will ask how they're going, what's the new findings. They'll talk about the most recent blood test, scan, or whatever test they're doing. Bone density test, ECG, MRI. They'll talk about it, and then they will talk about what they found, what they think they are, how they think they should go forward, such as treatment, medications, and what to do. Yeah, future treatment plan, as you can see. All right. However, sometimes don't worry if you find that some of the medication, right? You don't know what that is. At first, of course, something like aspirin, Panadol, those are fine, but you don't know what Lipitor is. Okay, I don't know what that is at first. My digestion was totally fine, and sometimes they will tell you, okay, your dosage of Lipitor should be whatever, and if you don't know what that is, it's fine. Sometimes the patient understands. But if the patient doesn't know and you don't know, it's absolutely okay if you just say, nowadays, again, you have an iPhone or Samsung or Huawei, whatever you want to use, you can always say that, can I go online and check out what that is? Sometimes the doctor will know what that is. Believe it or not, they will give you easier, simpler words for that medication. But sometimes there's definitely no way. So you just have to check out on Google it, find out the name of the medication, and then tell them the medication, tell them the dosage, make sure you get the number right. Sometimes dosage, whatever milligram that is, what time it is, sometimes I like to take notes on my book. Yeah, I like to take notes. So once I took notes, I write down just in case so that I can remember it properly and tell the patients. So this is a very common part. And then other parts, if someone had an injury, they'll talk about physiotherapy, they'll talk about, rehabilitations, that kind of things. That's a common thing as well. So this is what we see a lot in medication. and medical interpreting. That's what I meant. Sorry. Um, and then after that, they talk about the condition, talk about how things are going, talk about medication issue, talk about recovery, talk about future plans, sometimes talk about operations or upcoming treatment plan. Those things are the common one. Usually, medical appointment wouldn't be very long. Sometimes couple minutes, 5 to 10 minutes, other sometimes 15 minutes maximum. Usually, in the sidetrack, I would like to say that usually agency book you for 90 minutes for medical or job seeking agency appointments. And usually the longer ones are the legal ones and also the police ones. Those are the longer ones, but we'll talk about that in future videos. So, but although it is a 90-minute booking, but usually the doctor, they're pretty busy with a lot of patients lining up out there, and they will just tell you all the little details. They try to be very succinct, and you interpret. And once everything, they will always ending with this: Do you have any further questions? You will just have to interpret. 您还有什么其他问题吗？ Or 有咩问题? And then later, the patient will say, yes, this is my problem. Sometimes they will ask about the medication. Sometimes they talk about what to do at home, what to be aware of. Be aware, some of the patients could be very, very concerning and sometimes a little bit annoying. They will ask the question once over and over again. And your job as an interpreter is not to correct them, of course. You're not saying that, oh, you just asked that question again and I know the answer. That's not your job. If you met a annoying patient, yeah, you can always just interpret what she or he just say. Let the doctor deal with it. It's not your problem. Okay, you are booked for 90 minutes or you are booked for 1 hour. Within this 1 hour or 90 minutes, all you need to do is be able to understand what you heard and interpret accurately and in timely manner of what the other was saying. That's it. So they can be crapping all along. They can be repeating themselves. They can be, keep asking or reminding. You believe me, some of the 90-year-old lady I met that has been asking for the exact same question for 6 times over the time of 5 or 4 minutes. That I met that just a couple of days ago. So you don't have to worry about it. You don't have to roll your eyes. You don't have to you don't have to get mad. You just interpret what they say. Okay, it's fine. This is our professional conduct. So all you need to do is to try to be neutral, try to be accurate, try to be relevant, and of course you try to be what you say. You try to keep yourself calm. Okay, you need to keep yourself calm. And most importantly, you're not siding with anyone. Okay, you're not siding with anyone. This is very, very important. And we will talk about this, especially in case of legal and police context. Sometimes you might think, oh, this person's bad. What you heard something culturally speaking. This is not right. This. You've seen it. This person is obviously lying. Or in medical term, you never meet that. But in the future, when we talk about police and legal cases, you will see something like this. Okay, some of the answers that your client provides, in your mind that these are just all crap. But your job is to be nice and neutral. You have to be professional. You have to be, you need to control your emotion. Okay? Neutrality is the key for that. You have to act professional. So that's what I would say in a medical situation. So, and if you see suddenly some emergency occurs, keep calm. It's not your job to help anyone or direct anyone. You always look for the person who's in charge, i.e., the doctors, the fire warden. So you always look for the instruction. Protect yourself first, but don't run around. You're not obligated to help anyone extra. You don't need to walk the extra mile. Your job here is to interpret. And that's it. And talking about that, this is my last remark. Okay, once you start interpreting, you go through everything happily, and the patient is very happy. But there are 2 points I would like all the interpreters or users of interpreters don't understand is the wait time. Okay, and sometimes the interpreter was booked for 90 minutes, and then he was just sitting there, hoping that the appointment will start anytime soon. However, it might just go the wait time maybe as long as 75 minutes, 80 minutes. There were cases in Ioneer Hospital. Again, my favorite example. Um, it just go on forever. Sometimes the full 90 minutes or sometimes the full 3 hours gone, the patients are still waiting. At this point, usually there are two things. There are hospitals who has a little bit more funding. Okay, you can always speak to the interpreter's office. Make sure you do that before the end time of your appointment, because hospital fundings, they are limited. Okay, and when they say, okay, I booked you for 90 minutes, usually they will only pay you for 90 minutes. So if you want to get paid for the entire of your service, you have to report that ahead of time. Also, to do that, it's not just about money. It's you were actually representing your agency when you do your interpreting. Yeah. Up until this 90-minute booking, you represent your agency, no matter what agency you're coming from. So no matter what happened, you have your agency backing you. But for the first minute, the first second that went beyond the booking time, yeah, then look, then you are on your own. You're interpreting by yourself. So should anything happen, which could happen, someone fall, someone misheard you and done something wrong and took the wrong dosage at home, you could be liable. Okay, so you better be very careful. So if your time's up, 5 or 3 minutes beforehand, you can tell the doctor that my time is going to finish soon, so you better speed up. Or if you need me for further service, you need to speak to the relevant bodies and extend my bookings. I need to get permission from my agencies. If not, once the time's up, preferably the best practice is to stop interpreting and leave. I understand that's very difficult, especially you can see children's elderlies who need your help, but you need to protect yourself from legal liabilities. You need to protect yourself from any unnecessary trouble, because throughout this 2-3 minutes of extra time that you interpreted, you're on your own. You're not representing your agency. So if you were interpreting this very last bit, the doctor was trying to talk about some life-saving medication, the dosage, the timing of the medication, and it might have just the patient heard wrong, entirely wrong, but the interpreter will be held liable. They will be told that, okay, the patient was saying that that's what you said. The doctor was saying that you interpreted everything fine, and then the patient signed saying that he or she understood everything on the document, such as a operation document, a consent form. They will say that you interpreted everything. So it could be their fault. It could be a misunderstanding of the patient. This is a very a common phenomenon, but they can always blame on an interpreter, because no one will get hurt. The hospital wouldn't get hurt. The patients they wouldn't get hurt. They will always say that interpreter, blame the interpreter. This is a very common practice in many aspects of community interpreting. So you better protect yourself. Make sure you either finish within your booking time or ask for an extension prior. Yeah. So after that, once you finish what we call a wrap-up period, so before you go, you have to either get your payslip, or you have to get your phone. Now they are emailing all the sign-off sheets over the internet now, so you can sign off. Make sure you get the right person to sign off you, because if you don't get a sign off, an official sign off, either from the client or via the phone by your agency, you don't get paid. Okay, you spend 90 minutes, an hour, sometimes 2 hours working for it, you get $0 out of it, and this is not cool, as we are working usually as a casual or contractor. So the last bit, this is in fact an important bit, is make sure you sign off by the relevant body. If the doctor said, I'm not supposed to be signing off, you should find out who should sign off. You may even call your agency beforehand to find out who should be the one that's signing off. Some hospitals, right? Such as the Western hospital that I used to go to in Footscray, they will ask you to get signed off at the front desk. But some other hospitals, such as the Iron Hospital in the city, they'll ask you to go all the way to the interpreter office, which is usually quite far away from your client, to get that sign off. Yeah, that's or St. Vincent Hospital. This is a big one. St. Vincent Hospital has a lot of interpreters, so you need to get signed off by the right person who has the authority to sign you off. Then you can make sure that you get paid. So that's basically a brief introduction of what may happen during a medical interpreting situation. So I hope you like it. This only will be the first of many video I'm making in the future. I'll be talking about basically everything that I've been through in an interpreting session as a community interpreter, up until maybe the disease that not to be named passes through, and I will be continue. I'll be seeing you guys again. So thank you very much. Take care of yourself. Make sure you keep the social distancing, flatten the curve, as what we say here in Australia. And I hope everyone does well. Hope everyone is to be okay, doing fine, and hopefully, finger crossed, we'll be soon back to normal. For now, thank you very much for today, and I wish you all a great week ahead. See ya.